Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, and I would like to welcome you to episode 285 of the Ask Dr. Angela podcast. So much has been going on since we last met. I recently recorded a piece for PBS, which is going to be coming out pretty soon. It'll be aired primarily on the East Coast, Jersey, New York, Philadelphia. But anyway, I'm featuring a piece on gestational diabetes, which I'm really excited about. And the other really interesting thing that happened for me this week is I got a feature on NBC New York Live. Talk about fun. I got to hang out with Jackie Reed and Sarah Gore. Those are the two hosts on New York Live, and they were just simply amazing. So, I'm Dr. Angela, and everybody's asking me a little bit of everything. And so as I was being driven into the city on this past Thursday morning, and I got to tell you, there's something about having a driver. I'm going to have to make that happen. I think I really like being driven. But anyway, I receive queries all the time from all over the place. And as I was being driven into the city, I received a query from a young lady, and she said to me, "Can your intestines spill out of your CSection incision?" And I was like, where is this coming from? Apparently, there was recently something on a mom board where a new mom said that her intestines spilled out of her after a C-section scar burst open while she was showering. And so, the physician in me immediately kicks in, and I'm like, yeah, the answer to that question, can your intestines spill out of your C-section, is yes. But the other piece of this, does it happen very often? The answer to that is no. So just how does it happen? So the first thing that we have to define here is what a wound dehiscence is. And that's pretty much what happened with the woman in question. A wound dehiscence is when your incision separates. And that can be for many different reasons, which we'll talk about in a few minutes. The second thing that we need to define is something called a wound evisceration. And what a wound evisceration is when the abdominal contents, i.e. your intestines, come out of the incision. So this woman that I think was over in Europe somewhere, Edinburgh, if I'm not mistaken, she had a wound dehiscence, as well as a wound evisceration. Eviscerations rarely happen. Risk factors would include things like, if you have any kind of underlying infection, if there's poor surgical technique involved, for example, if there's too much tension on the suture line. Certainly medical comorbidities or medical issues like diabetes, obesity, if you have any kind of underlying collagen disorders like something called Ehlers-Danlos syndrome, that basically translates into poor fascia. What you need to know about the fascia and why this layer is so important is that it's basically the layer that holds your inner organs on the inside. When people have separations in their fascia, that's sometimes how you get into situations where you have a hernia. Some other things that would increase your risk of having either a wound dehiscence or even more rarely a wound evisceration would be post-surgery if you're not listening to your physician and surgeon regarding proper wound care, if you are lifting too much too soon. Anything that increases your intra-abdominal pressure, whether it's being constipated and you have to bear down too hard, anything that puts increased stress on the suture line, things like coughing, sneezing, all of these things increase the chance of something like this happening. And again, even though this is increasingly or exceedingly rare, these are risk factors that I previously mentioned. I've seen a wound evisceration once in my career. I have seen more than a handful of wound dehiscences, though. And, again, the wound dehiscence is when the incision separates. Those are typically much easier to manage than wound evisceration. And evisceration, which again is when the contents of the abdomen fall out, like the intestines, that's a surgical emergency. So I guess the take home here is be careful. I think that this woman in Edinburgh was in the shower and she bent over and, I guess this happened to her. I don't know anything more about the patient, specifically her medical history, what size she was. Again, I already mentioned risk factors for something like this happening. But just be careful and, again, try not to do too much too soon. This is a good reminder that even though C-sections are very common, they're still major surgery. And, being a major surgery, you still have to take the proper precautions with regards to healing and recuperating. So hopefully, this addresses that issue. I did end up emailing this query response back to the reporter. And so I'm sure it's going to be featured in some upcoming article. I'm not even sure which source I contributed to, but it was a really good question, a valid question. And again, a gentle reminder to take it easy for my moms out there that are status post a C-section. And it's also a good reminder of, the impact that other medical conditions, anything that compromises wound healing, whether it's poor vascular supply due to diabetes, kidney disease, chronic steroid use, etc., and the effects that can have on post-operative surgical healing. So bam, there it is. That query out the way. Hopefully this was informative to you. As usual, I want to thank you so much for tuning in. We've got so many exciting things going on this year. I already mentioned the recent feature on New York Live. I've got an upcoming feature on PBS. And of course, the release for my pregnancy book, which is going to be April 9th. I keep mentioning that because I'm holding myself to that date. I've promised you that this book was going to be released so many times in the past and it hasn't come out, but I'm putting it out there. I'm holding myself accountable. So April 9th is when it's going to be released. I recently, in last week's blog post, I'm soliciting people to review the book. A lot of you have reached out via email. If you don't get my blog post, you can sign up for it on the website, www.askdrangela.com. That's AskDrangela.com. On that same website, not only can you sign up for the blog, but you can sign up for my YouTube channel as well as my podcast. And you also have access to me via all of my social media outlets. That's Twitter, that's Instagram, that's Facebook. If you happen to have a question or a query or a topic that you want featured in the podcast, just reach out to me. I do respond to all queries. I get a ton of queries. So don't get, too disappointed if I don't respond to you immediately. I will get back to you. Promise. So thank you so much for your continued support. In closing, I would like to leave you with this from, one of my favorite books. It's Sandy Gingras, She Went Out on a Limb. And this is what I'm going to leave you with today. The carousel goes round and round. And you know what? You get a second chance. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 286 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.